that you can feel free to ask questions. We've got various things for our agenda, but just want to welcome you all. And yeah, and so if you could, please take a moment to put in the chat your name, your role, and what organization you're with. I am James Barta with Organ Eligibility Partnership. I'm the Engagement Strategies Manager, and we're the ones who oversee the eligibility system. So, and I'll be getting more into that in the first presentation. But it's great that you're all here. So we're still getting people coming in. So I did vamp a little bit there, but I'll go ahead and as people continue putting items into the chat, thank you very much. But we'll go ahead and get started then. And we had 5 minutes for the welcome. I'm only taking 1 or 2, but I'm happy to go ahead and move forward. And I'll start with a quick overview, 10 minutes or so, of the one system and what's been going on. So, as you can see, we work, the Organ Eligibility Partnership works with not only the Oregon Department of Human Services, self-sufficiency programs, aging and people with disabilities, but with the Oregon Health Authority and Oregon Department of Early Learning and Care. So we're helping determine eligibility for, we work with these organizations, their policy teams, to help quickly and effectively determine eligibility for people applying for, for Oregon Health Plan, for SNAP, for TANF, and for child care assistance, otherwise known as ERDC. So I'll just move quickly to a little bit of what I hope you already know. And Liz, you have your hand up. We're struggling to get the Spanish interpretation set up. Yeah.
Okay, got it. I'll be here.
Okay, thank you very much. So in any case, it's a little bit of a reminder, but how to apply? Well, there's 3 things. If you go to benefits.oregon.gov right now, you'll see these 3 different, well, you see the screen when you scroll down, the 3 different ways you can apply. I'll add a 4th really, in that you can mail or fax applications in too, but those paper applications. But if you look toward the bottom of the screen, really in the tiny print down there, get help applying for OHP medical benefits. You'll find, if you click on that link, hundreds of organizations that will, if you're not one yourself, will help people apply for the Oregon Health Plan. So, and there's also organizations that help with SNAP benefits as well. So, new information. Well, and then one other thing that I like to point out is that if you look on the left side of that screenshot, help in your language, you click on that, you'll get options for 16 different phone numbers. So if you have someone who wants to speak a particular language, there are 16 choices there. Now, if you just call the main line, the 1-800-699-9075, you get 4 options for languages. And so there's we have eligibility staff that know those 4 languages: English, Spanish, Russian, and Vietnamese. All right, enough of the review stuff. This past week, wait times on average were a bit longer. We've got eligibility queue was 12 minutes. The support staff was a rough 38 minutes, and even technical support for people who are having trouble getting their one system connected, having trouble getting into the system, not necessarily eligibility questions. And I just want to start right out of the gate by saying that this past week and a half has been unusual in the system. And maybe you're already aware of this, maybe you've experienced it, but for some reason, that the whole system has been very slow, and it's incredibly frustrating, I know, for you, and know that it's also frustrating for our staff. The analogy that I heard discussed within OEP is that it's like a funnel. And normally when we pour information into the system, it just runs through the funnel and it's fine. But right now, for whatever reason, that spout at the bottom of the funnel has been constricted, and we're pouring in the normal amount of information and it's flowing over the sides, which means that, to extend the analogy, that um, that that liquid or information that flows over the side, that just means things are getting timed out. People are losing connection and you have to start over. And so it's incredibly frustrating. Know that their teams have been working with Microsoft. Office of Information Services is working with OIS, or OIS is working with Deloitte, and there's some fixes that are happening that are hopefully improving the system. I hear it's getting better. It still needs some work though, but just wanted to be aware, if you've been having difficulty reaching people and getting responses in the system, that's why. Okay, so going on then. A little reminder that sometimes you don't have to talk to a person. If you simply want to check, if a client simply wants to check if they're approved, denied, or pending, or whatever, there is an integrated voice response that you can go through. You can also request an EBT card replacement without talking to a human being. So we're hoping to expand this in the future too. Now, I always like to, when I have these opportunities, to plug for clients who can handle it, the benefits of having their own one account. If they have a, most people don't have a laptop, and this is a screenshot of the laptop, but as you can see, you can quickly report a change, you can view your current benefits, view current programs and applications, you can request information, you can upload documents, all sorts of things like that. In fact, if let's see if I can just a moment here, and if you can use these tools to do all sorts of things, and so what I want to plug then is to open a one account. You can use these links to see the documents themselves are pretty short. There's a short video, and from a desktop, it's like a little more than 3 pages. Follow how to open a one account. So I just, it's like I have a contractual obligation to mention that sort of thing. And then if someone has is in the system, you can't apply through the mobile app, but you can view your benefits, see all your notices, get reminders before due dates, all these things. The app is available in English and Spanish like the regular system. And so it's just super convenient. And so we really want to encourage people to use this because it saves your clients time, it saves staff time. It's just an all-around win. The app itself is small. It's not going to track your movements, any of that nonsense. So that's my plug. It's like they should write that into my job description. I'm always going to be talking about that. All right. And then I mentioned this a few months ago, but I just want to emphasize, if your clients are expecting a phone call from ODHS, make sure they have this phone number in their phone. So to keep the phone from thinking it's spam, 503-945-5722, that's the number that people will get a call from. All right, now some quick updates. As you have seen, you've worked with someone who's applying, or if you're going to seek medical services, there are a lot of questions about people's race and sexual orientation, gender identity. We are obligated by law to ask these questions, and I will say that it is helping us look at our data and look at the populations who are applying and understand who, if there's any groups that are not getting the services they should be getting. In fact, I've sort of been looking at the data. We're noticing a group that for some reason it's taking longer for us to process their applications than other groups. So that's something we're going to be following up on. Of course, if people don't want to respond, that's their right and that's their option. And so there is a prefer not to respond option as well, just to know that. And I forgot to update this slide, but I'm going to skip by this and say that we're still in the process of getting more languages out. And over the next year and a half, there'll be 136 languages that notices will be mailed out in. So just keep in mind that if client wants this language, that's what they'll get. They won't get the English one. They'll be able to see an English one if they have a one account. But just keep in mind, if you're helping them, know that, whatever language they sign up for, that's what they'll get, period. All right. Now, I'll make a little plug for this partner page that I fought very hard to get this page up. So please use it. They look at how many people visit it, and hopefully it is useful. Give me your input and what you think about it. And it's got plenty of videos. It's got plenty of flyers, information. So take a gander. I'm always happy to hear your input to make it better and more useful in your work as you help your clients get the benefits they deserve. And I do host a couple different meetings, one of which is coming up in just in less than a month, where we'll start off with a very short presentation, and then it's like an office hour. It's just open time for people to ask questions. So our next one is coming up September 10th. If you are curious about attending, just drop me a line. And I'm putting in my email right now, so please let me know. And also, if you have suggestions on how to make this one system better, notices, mobile app, whatever, we have a form for that too. Of course, we have a form. So I get these directly. I'll respond to you to let you know what we're going to be up to with it. And finally, if this was all old hat and you're aware of all this, this is sort of the 401 class now. And if you really want to dig in deep on how to apply, like for instance, for SNAP, we've got an 80-minute video of one of our business experts walking through an application. Carolyn, yeah, I see your hand.
Yes, hi, thanks, James. So I'm with the marketplace, and I was conducting our the marketplace certification training for application assisters yesterday, and I was asked actually if there is for the benefits, like the APD benefits and such, if there's more information that the community partners can get on like delving deep and understanding more of those specific pieces of the applications within one.
Yeah, well, I would be happy to talk to them. Sort of got two versions. I give an overview, and then I can bring in a technical expert to do a deep dive into the application.
Okay, perfect. I will connect you guys via email then.
Perfect. That's wonderful.
Thank you so much.
Yeah, absolutely. And so yeah, maybe you're tired of your streaming services or something. Like I said, it's 80 minutes, but you can also, there's timestamps, so you can jump to the part that you might find the most interesting. And if that's old hat, there's another video that has the features of the one system. And I like to point out the last 20 minutes are just talking about the features of the mobile app as well. So this is sort of your upper division courses here, but I know the application system is a little bit of a black box. And unlike a paper application where you can thumb through, you can't do that with the one system. So this is our attempt to have that available. So that is my little presentation. Any other questions? I pause for a moment, but otherwise, I am happy then, a little bit ahead of time. Well, no, not ahead of time at all. I took too much time. Megan, with the birth certificate program, I think I saw you come in.
You did. I'm here. Yes.
Excellent.
Let me just get it ready. So, hi everyone. My name is Megan McLean. Let me turn my camera on. Apologies. I have a new laptop, so I'm trying to figure out if it's working right now. My name is Megan McLean. I work with the Behavioral Health Investments team as their new team lead, and I'm just, if somebody could put in the chat that in fact my camera is working. Oh, there it is. It's working. All right, great. I work in the Behavioral Health Investments team, and one of my new assignments is working with the free birth certificate program. So give me about 1 second and I'll share my screen. Okay, hopefully everyone is able to see this.
We can see your PowerPoint.
Perfect. So the new assignment I'm working on is helping individuals in the state of Oregon obtain free birth certificates. And so today I'm going to talk about just kind of the history of the program, what it is, what it does, how individuals can apply and participate with new grant agreements or contracts, some changes that are coming up for those who might already have contracts, grant agreements, because we've got some new changes that are, I think, going to be really beneficial for those community partners that we work with, especially in the nonprofits, and then open up some time for question and answers. So this is the free birth certificate program is funded through House Bill 2402. And it allows funding to go to various provider organizations to help individuals who are homeless or at risk of homelessness to get a birth certificate so that they can access predominantly housing, though we know that a birth certificate allows you to access so much more than that, right? It allows you to get a driver's license, to maybe get identity, to for whatever doors that opens, also access various levels of services, SNAP, ERDC, Oregon Health Plan. There's just so much that this opens up. So just for the sake of this program, homelessness was defined as individuals who lack a regular, fixed, adequate nighttime residence. So that could mean that, you know, they're couch surfing or they're temporarily staying with friends or family, that they're somebody who might imminently lose their housing, which could be housing they own, rent, or just live in. So it doesn't mean that they're yet without housing, but that could be something happening in the very near future. It could be our unaccompanied youth who are experiencing persistent instability, or any individual that is fleeing or attempting to flee domestic violence, dating violence, assault, stalking, or other dangerous or life-threatening conditions in the individual's current housing situation, who would have no other residence or lacks the ability or networks to obtain permanent housing. So that's kind of the overview of the program. I'm going to take a brief pause and open just for questions, just briefly, if there are any. All right, let's keep moving. So how do our organizations participate? Well, they would fill out a request. And I promise you, this is not a long application. It is technically 2 pages, though the second page is mostly a picture of the state of Oregon, and you circle what counties you serve, because we have to track for legislative purposes what counties are being served and what counties are not, and you have to put your signature. The first page is mostly like name of your organization, your address, maybe you have a mailing address that's different than your actual address. What is the name of your organization? Can you give us your website? What's your name? It's pretty simple. Probably won't take much longer than 5 minutes to fill out. Once you send that in, I may email with you just to confirm how much you want your grant agreement to be for. If you have been participating in this program, we're doing what you have spent plus 20%, because any funds that haven't been sent have to be recouped. It's part of the requirement of this bill, and it's allocated each year. So funds either have to be sent or recouped. If you haven't participated, I'll want to talk with you about how much you think you'll spend. We don't write the original contract for more than $2,000. That said, if you do get close to spending more than your grant agreement amount, even if it's a smaller amount because you haven't spent that much in the past and this year you're growing the program, we can write an amendment and add more funds so long as we have them. I've been legislature allocates $50,000 per biennium for this program. So that's how much we need to spend. So we get your form, I put it in, a request a grant agreement, it goes out to your organization, you sign it, and you send over an invoice for the amount listed in your grant agreement, and we send you a lump sum payment. And then quarterly, you send in a report stating how many birth certificates, how much it cost, any success stories, and yeah. And there's a pre-form, like a template you can fill out that makes it super easy, and it's just a couple of boxes to fill in quarterly. Just in case folks are wondering, these birth certificates can be ordered by mail, by phone, in person. You can order them for people who are accessing your organization that live inside or Oregon or outside, or using expedited means, or people who were like coming in and accessing your services and don't even live in the state of, or weren't born in the state of Oregon. So if they are coming into your program and like, but I was born in Wyoming, great, use this money, go send it to state of Wyoming's vital records. You just put it on that quarterly report. And we want people to have access to housing and reduce barriers and trauma in their life. So if using expedited means and paying a little extra for getting that birth certificate to them faster means reduced harm, that's what that money's for. So like I said, there's a quarterly report. I have a pre-organized Excel spreadsheet I can send out if people want that for their accounting purposes. You list your name so that we can track it and we know it's you. You just list what methods, like we ordered 3 by telephone and 5 by internet. We served 8 people, and here you go. And either our organization was able to get it to that person or they weren't. Even if you can't verify that the person did receive it, because maybe you mailed it directly to them and you didn't get like a receipt back or whatever, you can still use the funds cover that. You tell me exactly how much you spent. So sometimes you're going to order a long form birth certificate or a short form or expedited, whatever. It costs different amounts. Just let me know. And one of the changes coming up is that organizations will now be able to use 12% of their grant agreement amount towards administrative costs. So you can list that on there now if you want. And then just at the bottom, if you have any great success stories, we've collected quite a few, like people have been able to access jobs that previously wouldn't have been able to because they were able to get their birth certificate and use that to secure a job or secure housing or enroll children in school or themselves in school. And this just helps with like the whole data mining and telling stories. Is we're asked if this program's doing any good. So here's the counties that are being served. You can see the whole I-5 corridor well covered. Multnomah County has 3 different organizations. We have, what is that? Clatsop up there in the corner with 2, and Lane with 2, and a few others with 1. But you can see that there's huge swaths of Oregon that just don't have any programs offering this service. So especially if you're in that area, this might be a good place to branch out. If you want to participate for this biennium, there is no cutoff date. I would ask that you not send a request to participate in this program in June of 2027 when the biennium's ending and you won't have a chance to spend those funds. But otherwise, it's not like, oh, you already missed it. Nope, you can send those in. I can send you the form and you can get those over. This is a legislatively funded program, so it runs through on the biennium basis. So we started our new biennium July 1st, 2025, and it'll go until June 30th, 2027. And those grant agreements will be issued for that duration. For programs that have already been participating, you will receive an invoice to recoup the leftover amount if you have any that you have to send over, and you'll get a new grant agreement with new funds. Like I said, we'll be issuing for returning participants, their grant agreements will be based on the previously expended amount plus 20%, so that there's room for growth. For new grantees, like I said, I'm going to talk to you about how much you think you'll spend. And if you get close to a point where you're going to expend all those funds, let me know and we can write another amendment to your grant agreement and more funds can be sent out. And please don't forget to send in an invoice. We had several programs that were participating but didn't send in an invoice, so they didn't get that lump sum up front. And ironically, they were some of our best like expenditures of these programs, but they sent things in after the fact, and I'm not able to amend their contract to add more funds once the biennium's over. So I just want to make sure that folks are getting funding. I know how hard it is to be a nonprofit, and having those funds are something that will ease burden. So I want to be as helpful as possible. And just one more reminder that those reports are due 45 days after the quarter ends. So here's a calendar of when that ends, and you can send them in to myself or the Behavioral Health Investments team group email. But I'm also going to send out reminder emails at the end of each quarter, so don't worry. I mean, it would be lovely to be a self-starter and send those in, but for those who don't, you will get follow-up emails as well. And like I mentioned, 12% of the costs can now go towards those administrative costs, or 12% of the grant agreement can now go to administrative costs, because we recognized and had heard so much about how this program could be beneficial, but it was also a administrative cost burden. And so we wanted to help reduce some of those aches for our nonprofits who are doing this necessary work. So I'm going to open it up to questions now.
Megan, I'm curious, how many people do you estimate that the services worked for?
You know, I don't have those numbers in front of me. I can get back to you with that. This is our first go around kind of collecting that data and really drilling in on it. I can find that out and let you know. I do know that we've been having about 20 participant organizations, so that's been really helpful. And if I'm just doing some like quick cocktail math, it could
I don't mean to put you on the spot there.
No, that's okay. That's actually a good question. And I feel like that's one that we should have on our like easily accessible for our data. So I actually am using that in real time to add it to our tracking sheet, because that would be something that would be really important to know. So let me pull up real quick and I can do some quick math. Say 24 and at least 300 people would be my estimate, just based on some quick math. Yeah.
Wow. Because I'll say that it's such a foundational thing, as you already pointed out. I vividly remember getting my new driver's license, and there was someone next to me, two people, one of whom became agitated and left, and it soon became apparent the other person was a caseworker who was trying to get the individual who became agitated after waiting who knows how long, 2 hours probably there to get a state ID. And it's difficult because I didn't have a driver's license. And I didn't have a birth certificate, and there
Yeah.
was just little that the DMV could do. And so it was a sad, frustrating sight. But yeah, so it's such a foundational thing that unfortunately this society requires. And so this sounds like such a great program, and I hope some organizations become interested in it.
Thank you. And as you mentioned, it's a really, there's not a more, it's an imperative time right now for people to be able to have access to ID, and it opens so many doors for individuals. And it's not like we just work with nonprofits. We also have one contract with one of the local DHS offices. So that through an interagency agreement, that's something we're very willing and excited to do, because so many people come into the DHS offices looking for assistance. And if that's the first step to getting any of those services, that would be awesome. So we are very excited to do interagency agreements. We also have a contract with like the Marion County Public Defender's Office. So that's another kind of government agency that we work with. And any of the like community action teams, anybody that wants to partner with us, we are very interested in being collaborative and finding a way to write a grant agreement, interagency agreement, and get that working.
That's impressive. Thank you, Megan. Any questions? Oh, there's one.
Yeah, and I'm definitely open to like send me emails, have conversations with me. I will put a time in my calendar for us to have a talk, and we can have those conversations to make that work for your organization. Yes, they are listed somewhere. Let me get you that website real quick because I have it pulled up. So this is organized by county, and you should be able to pull that up and just look at who those organizations are in your area if you want to point people towards those organizations. There you go.
Nice.
Awesome. And do feel free to reach out to me for any reason.
Thank you, Megan. Thank you for coming here.
Thank you for allowing me, James.
But in any case, appreciate your work, and we're a little bit ahead of schedule, so we don't have our next speaker just yet, but we can do a Q&A, but I'm going to go ahead and just start by saying many of you are probably wondering, well, what about the elephant in the room? What about the big subject? Well, all these federal changes. It's difficult. Know that there's a lot of I know it doesn't match the stress of people who may be facing benefit reductions or outright removal, but there is a lot of stress within the agency, of course. And we have ways to have this information disseminated carefully, because we want to make sure that there's not speculation, there's not a lot of different talk. We want to make sure things are lined up carefully. And so in that spirit, I'm sure many of you attended the previous webinars. I don't have the dates in front of me. And yes, there are a couple websites I'm going to share. One is our page that discusses the upcoming changes, and it is updated regularly. You'll see, well, the last update, I guess, was 9 days ago, but nonetheless, we do update how we understand these changes and what's going on. And so I encourage you to look there. And this past week, though, the governor's office did put out a lot of information. If you follow, I'm sorry about so many links here, but if you follow the links in this press release, you will find a lot of detailed information that whether it's for SNAP, whether it's for OHP, other changes in general, a lot of the budgetary impacts, just keep in mind that in terms of budgetary impacts, there's some, I would normally use the term a lot coming this biennium, but then even more, much more in subsequent bienniums. And so how the state will react to that is up to the governor and the legislators. So we don't know right now how a lot of these things are going to be affected. And I'm trying to be very careful of what I say because there's only so much that I can speak to in detail. But I know it's a trying time, and I know it's a difficult time for you and your clients. So, any questions? Any comments that anyone has right now? Okay. Well, it probably doesn't help when I say, well, I can't say too much, but nonetheless, I hope you use these websites and for more information. And I see our Deputy Director for Self-Sufficiency Programs is here with us to talk about the next item on the agenda. So Yvonne, I'll hand it over to you. And you're on mute.
Okay, great. Thank you. Thanks, James. Good afternoon, everyone. My apologies for joining a little bit late. I thought Zoom was ready to go and then I had to register and do all kinds of things. But for those of you that I don't have the pleasure of knowing, I'm Yvonne Lopez. I'm the Deputy Director for the Self-Sufficiency Programs. And Claire is not able to be with you today. So she asked me if I wouldn't mind coming and doing an update on the ODHS transformation. So that's what I'll do today and take any questions that you all may have. Let me grab my notes for a minute. Okay, ODHS transformation. I am wondering if just with a show of reactions, is this the first time you all hear about this? Have you been hearing about the transformation? I would love to just kind of understand where you all are in the realm of ODHS transformation news.
There was a presentation 2 months ago, I believe.
Okay.
Here, Maria Ross spoke to it.
Perfect. Okay, thank you, James. We have been in design phase of the transformation. So more than a lot of self-sufficiency, child welfare, aging people with disability, and a lot of ODHS staff and partners have been interviewed and contributed to the design phase of this project. There are 3 pillars that we have been looking at. The 3 pillars that we're working on is looking at our service delivery model. How do we coordinate and integrate program services so that we're better able to serve customers in our communities? And then how do we help support the local service delivery operations? That's one of the pillars in the transformation. The second one is administrative functions. How do we align our internal administrative functions through our district operations so that we can improve support across all programs and frankly be able to reduce kind of the administrative time that district managers and other administrative staff spend in these administrative functions so that we can spend more time in community with the families that we serve as well as with our community partners. And then the third one is developing a children and family services continuum, which helps support kind of serving the needs of the family as a whole, promoting economic mobility through the continuum, as well as strengthening the child and youth well-being through this continuum. The programs that would be involved with that would be the child welfare and the self-sufficiency programs, really looking at the life of the case, essentially. So as I mentioned before, the last couple of months have been design phase of this transformation. There's been a lot of engagement with tribes, engaged with different programs across ODHS. There's been a lot of conversations with our local service delivery districts so that we can really ground the recommendations of design in the realities that are happening on the delivery side. And then really interested through this design phase to look at all the aspects of the work that we do, from rural offices to metro offices to offices that are standalone, as well as offices that are co-located, whether it's with each other within the programs or with other community partners. And so the current focus is solidifying that design phase, as well as developing a roadmap and some actionable steps and recommendations that leadership and the steering committee can respond to and make some final recommendations to our leadership. In terms of the timeline, like I said before, we're in the final stages of the design. The steering committee will take a look at it, look at all the proposals, and then make a final recommendation. And then the agency will begin to look at planning for implementation. And some of that will include further consultation with the tribes, assess the recommendations, as well as develop, presentations for other partners in this transformation, like our legislative fiscal office, governor's office, and other legislative partners. In the meantime, the transformation team continues to visit office across the state to continue to learn what are the day-to-day realities of the work and how this transformation will help improve services. We want to strengthen the good work that's already happening in the communities. So currently in July, there have been offices to John Day, Burns, Grants Pass, that have really offered some insights into smaller and rural communities, sometimes previously underrepresented sites, and really also looking at the district as a whole. Additional visits will happen, or I believe they may have already happened this month, in Eugene, in Albany, and further visits are going to continue to happen throughout this phase of implementation. The feedback gathered in these sessions are directly influencing how the final recommendations are going to play out in an implementation process. We've also had numerous all-staff office hours where staff, once they understand what the transformation is, have been able to come and ask questions. The implementation phase will take a look at areas that are maybe, how do we implement in a way that we have some low-hanging fruit, things that maybe we've intended to do previously, and this will help us solidify our plans around integration of services, and then begin to look at those 3 pillars and identify what a full implementation plan may look like. That will happen between now and January. And like I said, a lot of legislative engagement, partner engagement, as well as continuing to visit offices across the state. I'm going to pause there, James, and see if there's any questions and anything else that you all want to hear about connected to the transformation. And I have not been monitoring chat if there's anything there.
I mean, it's, you know, it's ambitious. It's bringing together, aligning our work, self-sufficiency and child welfare in different places. So, yeah.
Yeah, I think it's a great opportunity for us to take a look at the areas where things have gone really well as areas where we know there's room for improvement, you know, and things we have heard both from our staff and our partners. And so this is an opportunity to take a look at this. And again, the continuum is centered in both the ability to serve families as a whole, as well as how we better integrate our services so that families aren't having to navigate our services, that we're, you know, kind of doing that behind the scenes as we serve families. All right. I don't know if there's any questions, but I'm happy to, if there's any questions that come up later, I'm happy to take those and bring back what we can.
Thank you, Yvonne.
You're most welcome.
Come back anytime.
I will. Thank you.
And if there's, are there any other questions or comments or anything of that sort? I said my piece about both the slowdowns in one and some links for the federal response, but nothing else, then I'm not going to keep you. So please continue your good work, and we are here to answer any questions. So I hope things go well, and be in touch.